Welcome to COVID Conversations. This is going to be a new weekly video series where we're talking about the latest information that you need to know about COVID-19 right here in Gaston County. My name is Adam Gobb. I'm the Communications Director for Gaston County, and I'm joined with the Public Health Director, Steve Eaton, who's here to talk to us a little bit today about our key metrics, the latest data and information that you need to know, and then we'll be joined a little bit later on by Commissioner Bob Hovis. He's from the Crouters Mountain Township, and he'll be talking a little bit about some of his experiences and stories that he's heard right here in the community. Steve, I want to talk and start with you. What have we seen over the past week here in Gaston County that folks need to know about?
Well, first off, thanks for having me, because I do think this is an important time to speak to the community about what we're seeing, because quite frankly, it is alarming, the number of cases that we're seeing and the level of spread in our community. So when we first spoke to the commissioners last Tuesday about what our current key metrics were, we've seen and continue to have seen a day-over-day increase in both the number of new cases as well as our positivity rate, and those who are having to isolate and quarantine across the county due to the spread of the virus. I believe when we spoke on Tuesday, the average daily case count was around 140. We're now at about 180 per day. 2 days last week, we had over 240 cases. So very alarming and very concerning. And over the weekend, we had 156 pediatric cases between the ages of 0 and 18. So of the 156, of the total number we had over the weekend, 28% were pediatric cases.
Well, and to kind of put that in context, folks, when you go back to what we were seeing in January, when you're talking about close to 250 cases per day, that's getting pretty close to what we saw at our peak.
Right. And quite honestly, when I spoke with the commissioners last Tuesday, we talked about being at that January point within 3 weeks, and we've accelerated to that rate, and that still is a very good possibility. The number of daily cases is very close to what we were seeing in January, as well as the number that are hospitalized. At our highest point in January, we saw about 150 hospitalized, and right now we have 122 in the hospital currently.
And you know, one of the things that maybe some folks don't realize is over the course of the pandemic, there's been a lot that's been learned in medicine in terms of effective ways to treat this, and you know, just different ways that doctors and hospitals can deal with people that have COVID-19. So if we were seeing what we're seeing now at the start of the pandemic, there'd probably be even more folks in the hospital, right?
Oh, absolutely, absolutely. In fact, Caramont specifically, as well as our other hospital systems in the surrounding area, have done a phenomenal job of being able to treat people. At the presentation on Tuesday, I learned something new, which is that Caramont is treating 160 cases in a virtual hospital that allows those folks to be able to remain at home. But those are, to your point, would have been folks who would have been in the hospital. And they currently have a census of about 100 right now that are inpatient. So that's 260 some odd patients that at the beginning of the pandemic, before all the treatments and ability to respond to those who are sick was developed, would have been in the hospital and would have overwhelmed our healthcare system.
So one of the things your team does each week is kind of put together a key metrics report, and we're going to kind of dive in a little bit to that.
Sure.
But we've got some slides that will pop up here that Steve can reference. But this is something that you guys use not only to keep our board and our leadership team informed, but really anybody in the community, because it gets put out on our website as well.
Yeah, these are the key metrics that the state follows, and we follow locally, because what these key metrics do are they provide us the epidemiology, or the science of the spread of the disease. And so as we go through these, I'll explain to you what we're looking at and why they're concerning. So all of the key metrics that we are looking at this week are all in the red, which means they're at dangerous levels, and they were all in the red last week as well. So the first one that you see here is the percentage of ED visits with influenza-like illness. And so we all know that many of the COVID symptoms are very, very similar to the flu. So one of the ways that we can monitor or provide surveillance of the virus is to look at those who come to the emergency department with influenza-like symptoms. And as you can see here on this slide, all of those numbers are and trends are going upwards, which keeps them in the red. This is another metric we look at is once they're in the emergency department, how many or what percentage of those individuals actually then have to receive a COVID test. So after they've seen a physician or seen a medical provider in the ED and have their symptoms diagnosed, how many of those folks then receive a COVID test? And as you can see here, those remain the highest that we've seen since the January peak of the pandemic. Now this one, as you'll see here, is something we were talking about earlier, which is the daily new cases. That blue line that you'll see jumping up and down are the individual daily numbers or daily cases coming in. But what you really want to look at is the red line, which is a seven-day rolling average of daily new cases. And as you can see here, you can see that the peak in January was about 250 daily new cases, and we are now currently trending close to 200. So we are edging ever so slightly up to the very peak that we saw in January. The percent of positive tests is also something that's the key to watching the transmission of the virus. So as you'll see here, when you look at our county and many of our contiguous counties, we're in the highest level of more than 15% of tests are coming back positive for COVID-19 in Gaston County. And then this one is quite alarming when you look at the hospitalization trends. As you can see here, we are now peaking at where we were and maybe even going higher than where we were in January with regards to hospitalizations. Again, when I spoke with the commissioners on Tuesday, you can see that number was a little bit less, and now we're edging up over 120 hospitalized, and that includes both Caramont and Atrium. That's where we get that data from. This slide just sums it up all together and puts all that data, the cases, the hospitalizations, and deaths all on one slide. So you'll see the blue bars bounce up and down. Those are the number of daily new cases. So you can see where we are now. All of those daily new cases are trending up. When you look at hospitalizations, again, very, very low, trending up to a very high level. And then obviously anytime you have a high number of daily new cases and then a high number of hospitalizations, unfortunately we're going to see a large number of individuals pass away due to COVID. And just since August 1st, we've had 27 Gaston County citizens pass away from COVID-19, which is very sad and very concerning in our community. So just to put it in perspective, about 6 weeks ago, we were seeing on average 3 to 4 cases of COVID per day. On one hand, we could count how many cases we were getting in Gaston County. And as I said earlier, now we're up to about 180 cases on average per day. Same with hospitalizations. We had typically about 4 to 5 people hospitalized due to COVID. Now we're up near 120 in the hospital, and as I referenced earlier, Caramont has their great virtual hospital, which has over 160 patients in it. So obviously all trending in the wrong direction.
I want to say thanks for providing the data update, and I will say thanks for providing the data update, but it's grim. I mean, it's these are numbers that just based on all of the metrics that you guys track, I mean, nothing's going in the right direction right now.
It's not, and I get that question a lot. Like you have to be, really depressed. You have to be really frustrated, and you have to be, really worn down based on the numbers. But I kind of flip it upside down in that there's reasons to be hopeful, and that is we have 3 very strong and effective vaccines in our community that are available nearly everywhere. Pharmacies, medical providers, the hospital, the health department. Monday through Friday, 8 to 5, people can walk in, no appointment, and get a vaccine. We have incentives going on right now to get people vaccinated. We have an abundance of tests in the county. So I like to have people think back to where we were at the start of the pandemic, where there were no tests available. There certainly weren't 3 effective vaccines, and there was very little knowledge about the virus. Now we have an abundance of all 3 of those things, which are critical to ending a pandemic. They're right at our disposal. Now, where it is frustrating is helping people understand the importance of vaccination and helping people understand the importance of still continuing some of the mitigation efforts that drove those numbers down so greatly just up to 6 weeks ago.
Good afternoon, folks. I'm Bob Hovis. I'm your Gaston County Commissioner representing the Crowders Mountain Township. I felt like it was important enough that we use all the resources that the county has, being our TV channel as well, to get information out to the public where we stand in our current rise in the pandemic for this second surge that we've had, or actually third. It's important for all of us to recognize what we as individuals can do to help mitigate the spread of this pandemic, as well as to ensure our own personal safeties. I wanted you to know facts. There's a tremendous amount of data today that we never had when this first occurred. So we as a county are much better served to understand what we can do to mitigate the spread and to protect our own lives as well as our loved ones from finding this pandemic to cause a terrible outcome. That's the important thing. Fortunately now, Gaston County and our health department and our hospitals have abundance of PPE. They have all these weapons in terms of these new vaccines. And these testing methods are far, far better than they've ever been. So we have very few false positives. I'd like to share one thing that's occurred since our meeting last Tuesday, our commissioner meeting, that happened within my sphere of influence. One of my wife's very close friends attended a book club meeting with my wife over here in Gastonia. In doing so, they rode together. The next day, my wife finds out that the husband of this individual had tested positive for COVID. They were both vaccinated. They had very mild symptoms. The next day, the wife of this friend also developed symptoms. Extreme cough, headaches, no fever, but it was obvious it was the Delta strain. They immediately went into self-quarantine, recognizing what was going on. They immediately talked to anyone that they had been in contact with over the last 72 hours prior to symptoms being shown. By doing so, they helped individuals to know their potential of exposure and at the same time limited exposure to any other individuals that they would normally have been around during that period of time. In doing so, they advised my wife of their medical situation. My wife immediately went to Caramont Urgent Care in Dallas and received the PCR test. Thank you. I always forget that. The PCR test, and got her results back on Saturday about noon that she was negative. During that time, she self-isolated herself from other members of our family except for myself. And then, of course, when she was negative, and she never exerted any symptoms, nor did I. So we don't know who we come in contact with today may or may not create that opportunity of social spread. If we look at by wearing masks, by maintaining social distance, and by being responsible adults, recognizing when we may have had an exposure that could be real and it could be unreal to us in terms of how we've been affected, we are being careful and concerned about others. And that's what all of us can do during this pandemic, is think about other people as well as ourselves. None of us want to be involved with this. This isn't something that we've asked for. We don't get to pick and choose. It doesn't come out of a vending machine. It just happens. But we have that responsibility, once we know that exposure is there, to recognize others are just as important, if not more important, than ourselves. I say this because I have a mother-in-law who has a severe immune-compromised health situation. We are their primary care assistants. I'm sure many of you find yourself in a similar situation and you want to know the facts. And that's one of the reasons I felt like the county needed to use this time, this media, this resource that we have to talk directly to people, to share real life conversations. This isn't foo-foo dust. It's not something that's made up. It has nothing to do with politics. This is the real world of healthcare. And that's what we want all of you to understand.
So we're going to close each one of these episodes each week by talking about either some myths or some questions that you have. Now, if you're interested in submitting questions for our medical experts to answer, you can send those in by email. And that email address is covidvaccine, all one word, at gastongov.com. And we'll pop that up on the screen. So that's covidvaccine at gastongov.com. So, Steve, we've got 3 myths that have been kind of floating around. Some of them have been out there for a little while. And the first one that we're going to start with is fairly new. So this myth has really been in the news quite a bit lately, and it's the idea that taking Ivermectin can help reduce your chances of getting hospitalized with COVID.
Yeah. So when I heard this one, it's one of those I had to shake my head. And to your point, we've seen and heard so many different myths from the beginning of this pandemic. This one is concerning because it's putting something into somebody's body that potentially could be toxic. And they've actually seen an uptick in calls to poison control over individuals doing this. There is no data, there is no science that proves that this is something that is safe, and certainly that it does anything to positively impact your ability with COVID. So no, that is a huge myth, and every physician I've spoken to and everything that I've read, not a good idea.
Got it. Myth number 2, and we've heard this one a lot lately as well. Asking people to wear masks indoors, as we're both doing now, proves that the vaccines don't work.
That is, again, false. And the reason why is, let's go back to why the vaccines were created in the beginning. And I think this is important. The vaccines were created to do 3 really important things. One is to keep people from becoming severely ill with COVID. 2, to keep them from going into the hospital, and 3, to keep individuals from dying. And when you look at the data around those who are hospitalized with COVID, those with severe illness, and those who have died, the vast majority right now are the unvaccinated, nearly 90%. And so therefore, the vaccines are working. Masks protect you from me spreading it to you. So as we've seen, there are the possibility of breakthrough cases where individuals have been known to become positive. It's very rare, but it does occur. And when that happens, a mask keeps that individual from spreading the virus to somebody else. And so anytime we can add layers of protection for ourselves and for our families, friends, and neighbors, like masking, it's an important thing to do. So much like you, when I go into the store, I'm fully vaccinated, but I still wear a mask because I'm concerned about citizens, I'm concerned about the elderly who are around me, because what would happen if I am asymptomatic positive and don't even know it? For me, I am more than happy and more than comfortable to take that extra precaution to protect the community.
All right, so we're going to jump into the last myth that we've got for this week. And this is one, again, that we hear really frequently. There is no way to know what the long-term side effects of the COVID vaccine are.
So again, this is something that we have heard a lot. And there has been so much studying and investigation into these vaccines to ensure that they're safe and effective, not just for the short term, but for the long term as well. When you look throughout history and you look at vaccines in general, there's always concern about the long-term impact. COVID vaccine, not the least of which. And when you look at polio, smallpox, etc., the same concerns were there, but thank God for those vaccines because they saved countless lives. And the COVID vaccine is the exact same category. It's been so well studied. You look at the FDA approval, they had the use of over 200 million individuals to study to ensure the effectiveness, and they are completely safe and effective.
I'd like to finish, Steve, just like to ask you if there's anything else that you wanted to hit on that you really, from a messaging standpoint, that you want to get out to the community.
Yeah, so it's super important that individuals get vaccinated. We have everything that we need to end this pandemic right at our fingertips. So if there's anything that I can emphasize with the citizens of Gaston County is please get vaccinated. And if you do have concerns or you are hesitant, seek out a medical expert, call your physician, get their opinion, sit down with them and have a conversation. Because the only way that we will truly end this pandemic and all the various variants that could come with it is to have a very highly vaccinated population here in Gaston County. And for every individual that's not vaccinated, we have to surround them with a multitude of vaccinated individuals. If we don't do that, then we can expect to continue to go through this over and over and over again. But once we get our community vaccinated, we'll be in a great position moving forward.
It's really good advice. And, obviously, you talked earlier in the program about just all the different ways that you can go and get vaccinated. We have all of those resources for you available at gastonsaves.com, whether you're interested in learning about testing. If you have other frequently asked questions, we've got that resource available to you. And then all the different COVID vaccination locations. You can go there and you can find the quickest place to get a shot. And easy, they're free, and they're, like Steve said, they're widely available. Steve, thanks so much for joining us on this week's COVID Conversation.
Thank you for the opportunity.